Hello. Hi. Welcome, everyone. I know this is tough time right after lunch, so hopefully we are going to bring some interesting insights on AI. What I'm going to do is maybe just start with each one of you, if you can introduce yourself and also talk about how you have been currently leveraging AI in your practice, and especially in the accessibility space.
Absolutely. Thank you so much again. My name is Reza Abduli. I'm the co-founder and the CEO of Pulse GPM. What we are doing, we are bringing the ChatGPT to the healthcare. So talking about the AI, definitely it's been my passion last 2-3 years, and I'm enjoying these conversations. Implementing AI into the healthcare is crucial these days. It's going to help us, the providers, doctors, nurses, and also the patients. So many benefits we are gathering for them. I'm happy to be here, and I would like to share more thoughts on that.
So I'm Sam Saman. I'm serial entrepreneur, 5-time TEDx speaker, best-selling author for my book, The Singularity of Hope, and the book is about AI. And we are leveraging AI in a lot of forms. First of all, we have an AI company, but as well, I have a group of laboratories that does pharmaceutical testing. And we are using AI at all levels for quality assurance, for customer service, but also as what we call a special product, we have the co-analyst to help analysts do their job.
So hi everyone, my name is Dr. Thelma Zono, so I'm the CEO of Zips Medical Group. What we do in my company, we have clinics scattered all over in different states, and we basically see just veterans for their disability examinations. And with AI currently right now, it's really going a long way for us. So what we're trying to do with AI right now is try to get most data where we have something up to date, because we are seeing a lot of climb in different conditions. We're using AI to monitor those right now, and so over time we'll have very accurate data to help us. Thank you.
Thank you. Hello everyone, good afternoon. My name is Raj. I'm a co-founder of Vital Friend. Let me ask you a question, like how many of you are your parents living independently or living in assisted living facilities? So I see quite a few hands there. So what we offer is we provide a continuous remote monitoring service using Vital Friend. Vital Friend. So it's an AI care companion platform. So imagine, like, in my case, me and my brother, we live, I live in US and my brother lives in Australia. My parents are back in India. So it's always challenging to know how they are doing with their health, and it is very difficult to monitor remotely. So what we offer is, like, with the AI wearable devices, we can track their vitals instantly, remotely, and if anything that goes, like in case, like let's say heart rate goes up to 180, then immediately I get notified saying that there is something going on with their health. So we are using AI mainly to track their vitals, as well as to detect if there are any faults that are happening, to understand whether, if they require immediate attention. So there are, like, a lot of AI we are using in our product, and I would like to talk more about it. Yeah.
Hello, everyone. My name is Dr. Alicia Jones. I am a geriatrician by training. I have started an organization called Vitus Health. What we do is transition healthcare to be patient-centric. And we do that in a dynamic way by utilizing AI integration, because these are tools that, regardless of where you are or how much you earn, we can start providing quality healthcare to all of those within the country. We've seen AI transition the stage of healthcare. Right now, we have the capabilities, regardless of how much you earn, to start transitioning your quality of care. And it has leveled the playing field right now for all of those who are chronically ill, and by providing preventative health care for all. I am trained as a geriatrician, but I have recognized now, all of us are getting old. So as we age, we can age in place. We can age with dignity, and we can age in a way that we want to with AI tools.
Thank you so much for amazing introductions and also sharing how you have been leveraging AI and what are your expert areas. Now, I was curious, what are the key advancements in AI and wearable technology that have made major impact in the accessibility area in the last 2 years? So if there are any real-world examples that you can share with us, and anybody can go first. I am not sure who would like to start.
I think I can go on that.
Okay, perfect.
So there have been a lot of things going on over the past. The most common one I'm sure everybody knows is about the AI wearables, so the watches that tells about the heart rate. It's a big deal. We do have a lot of cases of patients who do have AFib, or we have a lot of cases of patients who have monitors on. But what happens, how does your mother know even if something goes wrong? It might beep on her phone, but the point is most people have access, just like my panelists had said. His mom could be in India, but he gets the alert once something happens. And we all have parents, and we know how they are, especially the older generation. So even if she feels a flutter, she just thinks it's one of those things that happens and just feel they'll be okay. But he can get on it to address it immediately and say, hey, you know what? We're going to have to call your doctor. We're going to have to do X, Y, and Z. So that's a big thing. I know at least from the millennials up, most people are a little bit iffy about AI, but the point is it's here to stay. So the earlier we get on it, the better. Let's look at everything. People have all the disadvantages they want to run about it, but there's problem everywhere. The fact that you drive a car, you could have an accident. But that doesn't stop us from driving. Just like any other thing, we can argue this all day long. I know someone who can swear by it that AI is probably saving something somewhere, and probably will have something that will happen tomorrow. But in the healthcare space, we need it. First of all, timing is important for us, the healthcare provider. Then you want to also monitor people. So who's going to be checking heart rates every hour? Depending on what condition you have. There's some conditions where you really want to, we send people home with Holter monitors. So we want to monitor things, so we want to get things real time. So those are like very critical examples that we can use in today's healthcare that we all need. Thank you.
Thank you for sharing that. So I'm curious, is that sending alert of some sort to kind of update on whenever there is any sort of intervening point?
Oh, yes, exactly. So somebody who has an AFib and then gets like a real fat beat that is above normal, it's been set to a particular what is normal for you and what is abnormal, what is something that we need to raise an alarm for. So things like that will show. So that's why he has it set up where he can actually get an alert. And I'm sure maybe her doctor also has that. But at least they can come to him first, who's the son, and then he can contact the doctor depending on what. Some ones even give just the actual reading. So when you go for your doctor's appointment, we're not getting any false positive or false negative. So we can see your track within the past 3 months, for example. So we can see the trend of things like somebody showing up at the doctor's office without eating, and then we do a blood sugar, and it's normal. And then when you go back and really look, you find out that they've been running at 200s or 300s before that day. So it helps to keep data and helps not just the patient, but also the providers. So at the end of the day, it's a win-win for everyone.
Thank you for sharing that.
Another way that AI is transforming the healthcare platform is even in behavioral health and mental health. Something that is being used is like VR headsets and using integrative health in allowing people who are usually being screened for low-grade depression and anxiety, allowing them to utilize it for yoga and meditation, and having an integrative health sessions that are either utilized with a physician, a psychologist, a psychiatrist, or even at home if they are low-grade anxiety and depression. And these AI wearables are very useful in care and even billable with the insurer.
That's great to know.
Yeah, add to my panelists what mentioned. So many tools right now we are using them right now, like a glucose tracking. They're gonna track your insulin, and what she said, it's not gonna just happen about right now. It's gonna track you and send the information to the provider last 3 months, for example. They're gonna adjust their determination and doing the treatment we're gonna provide in because they have more reliable information related to that patient. So these tools are like other Apple Watches and going to track your heartbeat and provide the feedback for the providers because they are There's sometimes there's just going to be bad days for you. There's going to be hard rates, and they're not going to decide what type of treatment going to provide for you based on that, because they have all of the last 3 months data from you. So these going to give better decision for the providers as well.
And another advancement I could see is the predictive analysis, because you are getting data from different devices, and with that data, you can predict what's going to happen. Like based on the past history, you can recommend saying, oh, you need to take these steps to avoid any abnormal, situations. And also with the technology now, with the AI. So imagine like, you need to go to particular doctor visit. You have the complete health profile of your patient, including not just the point of data. You have the continuous history of last 1 month, or how long they're using the device. You can create those benchmark profiles, and that will help the physicians to give right guidance to the patients to address any chronic conditions.
I will add something else, the same systems. These are amazing systems indeed for healthcare, but there is the aspect of how AI and wearable device can do what we call the physical human augmentation. Like imagine having 4 arms and an interface in your brain to control that with AI, of course. And this is not science fiction anymore. There is startups doing that right now. And in terms of wearable, I think the next leap will be somehow wireless control of other devices using a headset. We have the approach, of course, of Elon Musk, that is with implant, but there are a lot of companies trying to do the same thing right now without implant, without surgery. And they are succeeding. Not the same level of application, of course, because they are going very hardcore in terms of Neuralink. But other companies, I will not name some of them, are trying to give blind people vision by using AI, by giving real-time description, by another form of augmentation as well is improving hearing and giving you even superpowers, like
Wow.
Iron Man.
Wow, that sounds fascinating. So just along those lines, I was curious, and if you have any insights into how these are being integrated with, assistive technology such as the smart home devices, voice assistants, if there is any examples.
Yeah, of course, we can integrate them in all kinds of devices. That's the concept. But it will be better if you develop them as autonomous things, because I don't think our human brain is programmed to have 4 arms, right? So you need somehow some autonomy. And connecting to other connectivity is amazing. And I think it will look like we'll soon be all connected to the cloud, right? And maybe we can communicate telepathically.
Absolutely. I believe these days we can find the Alexa or Google Home in all of the homes that we have. And with connecting these devices to them, it's going to make it beneficial for us. So imagine your smartwatch going to detect your blood pressure going high. It's going to lower the light. It's going to lower the music. Call the 911, and they're going to send away for you. That's the goal. You're using all of this technology together, integrate them together to better output for patients.
That sounds fascinating.
Yeah. So another thing is like with the devices, smartwatches, you can integrate with, like as these guys said, like you can integrate with Alexa, Google Home. Imagine like as a senior, it can remind you about your medications that you need to take regularly. And it can say, hey, Raj, this is the time for you to take a medication. If you forget, it can remind you. And you say, no, I wanted to take it after half an hour. So it should automatically record it. And then it will remind you after 4 hours, from the time onwards, and say, hey, this is the time due. So it can add a lot more value, especially for seniors living independently. They can be, they don't need to depend on anyone. They can use this technology to be self-service.
Thank you for sharing. So I know we have been talking about a lot of possibilities, what can be done and what have been done. Now I'm curious, with all this happening, there might be a lot of challenges, which I can imagine, challenges from the design to privacy, like data privacy issues, utilizing the data. So I'm curious if, there are any examples that essentially you can share in that space? Like, what are the challenges that you have seen or come across while trying to implement?
I would say one of the pushbacks that I've seen is the provider pushback, the concern of how is this replacing that hand-to-hand touching of me? As a provider, I continually tell my providers, it doesn't replace the provider, it adds the tool. It helps us. It helps engage your patient more. And I continually to tell my providers, all clinicians, it will engage us further and it extends our reach. So please understand the AI tools, as we provide good information in, the breadth and the depth of which it will allow us it will extend further than we can imagine.
I would also support her too, because most times the problem is even us, the physicians, trying to, how we able to be open-minded to see how it works. The fact that we've been doing it this way doesn't mean it has to be that way all the time. I'll use for us with the veteran population, we do have people who have things like PTSD, so getting into an audio booth is a big deal. I've had people come in and it's a big deal. They can't get into there, they're claustrophobic. It's a real condition. So why would somebody who can't even back a door, you want them to go into an audio booth and you shut down the door? That's almost impossible. So it's been going, and then with the VA, it's this way. So if we can't get this reading, then we can't do this, then we can't do that. So you have to do it. So now if they're unable to do it, then we can't get any kind of disability for them. So now the VA, they came up with the whole kudu wave thing. So good thing, we don't need an audio booth now. But we still have problems with the older providers saying, how are we sure this is accurate? We've even had to do some examples where we get somebody in the booth to do the test and get them out and use the kudu wave, and they can see that it's almost the same thing, but some people are still flat out. So that's really a big push for us sometimes. Yeah,
I mean, one of the challenges I see was the data, because you are getting from all these different devices, and to aggregate and making it meaningful insights out of the data is one of the biggest challenge I see, because it's not just your wearables, you're also looking at the physical devices that are used at the hospitals. So there is data coming from all different angles. So you need to use AI in a way that will make it more effective for consuming the data.
And also, are there any privacy challenges that you want to highlight?
Absolutely. There are privacy and compliance constraints. Both are applicable to the, especially because we are looking at the regulated environment where the privacy is the key, and the environments where we use, whether, what kind of cloud environments you wanted to store the data, and on top of it, the compliance issues we need to look at how we utilize the data effectively.
Thank you.
I will add the regulation challenges. What's the point if we have the best invention in terms of healthcare, and then the FDA comes and tell you, hey, you cannot use it? And then this will somehow delay the adaptation and increase also the price, because more and more regulation is coming. And it's really a big challenge how you can explain to people who are used, let's call it, to dinosaur regulations, that this is a new technology and they need to make it fast. Otherwise, there is no point, right?
Definitely. I just want to add to what Doctor was mentioning. AI, these technology are here to empowering provider, physician. They are not replacing anyone. Yep. But one other issue I found it with other clients I was working with, the user faces of the devices. So for example, so many of devices these days are touch screen, but we do have patients that are blind. They are not able to use these devices. So one of the keys we have to implement these devices is to be voice control, be haptic feedback on them. And the other concerns come to the batteries, because AI's engines are consuming so much energy. These devices are dying so fast. So providing a better battery for these devices is going to be another crucial. It's going to be easier for patient and people, the users, to use them regularly, not just a couple of hours of using them. They are there, they are not feeling good, or they're lazy to put them back on the charger. So these two, I found it with the clients we are working on, the crucial touch screen issues on the batteries.
Thank you for that. And I know we have been talking about all the different angles now. One thing I do want to mention is like accessibility, and AI is not only about technology, but it's actually about making sure that these can reach the underserved communities. So again, there is, I've seen a lot of these devices are not that cheap. They come out like really, and just to give some examples, so for example, Aura Ring and some of the new devices that are coming, there's not only cost associated with purchasing them, but also with the subscription. So I think my question to you would be if any of you have any insights to share on how these can be made affordable, not only accessible.
I think it's going to take all of us working together, both the technologists as well as the clinicians, both working together to try then to say to the insurers, this is going to serve us all better. It's going to bring down the cost of healthcare. It's going to assist the patient. We need the provider, the payer, and the patients all working together to serve this ultimate goal in making our health system better. Right now, the costs in utilizing some of these wearables, not all of them, because some of them are actually very cheap, but some of these wearables, if we bring down that cost delivery model, we can serve a greater population, and then their costs can be utilized for more people.
Just want to mention that I believe we all need to change the view we do have to these tools. These are not gadgets. These are life-saving tools we are providing for the patient. I believe the next step is to healthcare is going to bring it up to the insurances. They're going to provide some of the cost, because it's helping the patient like a medicine. Why not we are providing some sort of insurance services for them and provide some of the cost for the patient?
I think the government needs to step in. This is like a one-in-a-time opportunity in terms of our lifetime. AI is our lifetime opportunity, and it's unavoidable that we cannot do this revolution relying only on patients. It's even impossible.
So again, I continue to think about it, and at corporate level, what I have seen is, and this is not just my I work for a pharmaceutical company, not just my company, a lot of other companies, they're offering, say, every year some reimbursement towards purchasing wellness devices. Again, it could be any of the device of your choice, but then they reimburse you the money to be able to, at least start using it. So because it's more about empowerment, that way you can have your own health data, and you can understand how things are. But then I'm just wondering, is there any sort of if say there would be a message that you want to share to say, what would be the message that you would want to share in terms of educating people about that it should be something that people should start thinking about, not only the ones with accessibility issues, but in general to take charge of your own health, so to speak. So is there, I'm just curious, what can be simplified? Because I know a lot of people think, I'm going to wear this, it's hearing me, it's taking my information away. So how can we change that sort of mindset, or have people adapt to these devices? So that way one step is already done where, people from a very early age have started to use these, and they're looking at their own health data and have that empowerment.
I would think, generally speaking, if you remember when Amazon just came in, a lot of people had problem putting in their credit card, where you have to put in your credit card on Amazon and save it. It was a problem initially. But right now, everybody's card is on Amazon. Some have all their 5 credit cards on there. So it's only just going to be a matter of time. So we have to keep talking to people. So when you come from the corporate world, we want to also let them know. So let's say flexible spending. Like you said, let's not look at it as a gadget, more like a life saving. You know what I mean? Like a medical equipment, more so. So flexible spending should be able to be used to buy that, for example. So we have to start from that standpoint. At least for those of us in America, we know that flexible spending you can use for a medical device. So it should be seen at that point, other than looking at it as just a watch. It will tell you your time, but it has other things too that it's doing. So education from our standpoint is going to be a big deal. to let people, and there'll have to be like a serious campaign about people taking charge of their own health, kind of figuring out what is going on. Because we're in the healthcare field and we think it's normal. If you go ahead and do a survey somewhere and you realize that a lot of people do not have a blood pressure machine at home. A lot of people, you will be shocked. I'm talking about educated people. It's not a financial problem, but they just don't have it. They just don't think they need it. You understand? So it goes back to the grassroots. We have to educate people. Let them take charge of that. That's first step first.
Yeah, I echo with that. Education is the key. We need to educate, about the benefits of using these devices. Mm-hmm. And also another thing I could think of is mainly focus on, it's not like a cost that you're putting towards expensive watch. It's more about your health, your data. You are in control. It will help you avoid any abnormal things that could happen in the future. So it's more about the education, and also we need to work with the government bodies to help from Medicaid and Medicare. They can also come in and help these, especially underserved communities, to provide these kind of devices for free so that, they can monitor their health remotely.
I think the economics of health is very complicated, as all of us, I'm sure, would agree. But I think when we start with prevention, and I believe these AI tools allow us that preventative tool. When we start with prevention, we save money. As opposed to working on the acuity in pharmaceuticals, a lot of times if we start with the preventative care, we start at a different role model. And we can do both. We can do both consecutively. But as a clinician, I believe using AI tools is a better or is an easier way to start. And we start there, AI tools, start that journey, continue that journey, assist again with the provider, the payer, as well as the patient, because the patient also needs to be educated in utilizing these AI tools because it's new and it's different. It's been around now for about 15, 20 years, quite frankly. It's really not that new. But educating the patient to accept it also, as well as the provider, and then the payers to pay for it. These are all tasks that all of us need to engage and take up.
Thank you for sharing. And this would be something I think once we open to audience questions, this would be great to hear from audience as to how we can educate people more. So I have one last question, and then I guess we'll open to the audience question. And because, we have talked about, possibilities, challenges. Now, if we don't talk about the future, which is, the innovation, then, this is not going to be a great topic. So I'm curious, and maybe we start from you. I want you to share what you think your vision is for that 5 to 10 years, where the space, how it would look like, what these wearable devices could be, and how can they change?
I do believe that the AI wearables will transition primary care. I believe it will be reducing of provider burden. I believe that for my seniors, for my women who are experiencing high maternal death rates, I believe it will be a transition point to why and how we see within the United States us being one of the worst case delivery models of healthcare. I believe if we start identifying where within our health deserts to start engaging and delivering these AI deliverables that are really not that expensive, if we start identifying these deserts and start providing access to these wearables within these communities and these neighborhoods, we're going to see transitions of care. And people are going to start asking, well, why is my hemoglobin A1C elevated? We're going to start educating people to be advocates for themselves. And as they're advocates for themselves, we're going to see a transition of that we're not going to see as many diabetics, as many CHFs, as many people with liver failures. So we're going to see a transition in our healthcare platform.
So AI wearables is going to become as a commodity, and everybody will have one. And it's not just monitoring, it also enables you to, it's like, did you go to school? Did you have your band, right? wear a band and go to school so that we can monitor remotely. So, and with the technology advancements that's going on, we can not only just monitor it, we can also do advanced things like geofencing, fall detections with the accuracy. As the technology is evolving, the dependency and the trust on the devices will also increase. That's, I think, in the next 5 to 10 years, what I would like to see is everybody is having their own health profile and they maintain it themselves. And for the physicians, it's a less burden, as you said, because they have the data in hand as and when needed.
Yeah, so that's a great vision. So I think what I'm hearing you say is that it's going to be part of our life. So it's not like exception or
Right.
just a population. Everybody will have their own device. And it's like kind of how you wear clothes, you will be wearing
exactly.
one of those.
So for me, I think with the AI, in another 5 to 10 years, I think when it comes to research, it's really going to help us a lot because we're going to have the data available. We're not looking for people we need 20 black men that are on Lipitor and what their liver functions have been, for example. We have that right there. So when it comes to the research part of medicine, it's going to be a game changer. I can say that for free. Every data will be in there. All we are asking AI is to pull out young Caucasian men between the age of 30 and 50 that have been on insulin for this amount of years. And that's all what the researchers need to give us the results. We're not trying to recruit new people. We're not trying to pay people off. It's just going to be a normal thing. So now it's not going to be we have research where we're looking for 20,000 Asian men, or we're looking for 20,000 black females. Everything is just going to be in there. So let's look at it from that standpoint. That's where I see all this going in the next 5 to 10 years.
Thank you.
Yes, it's ambitious today to say what will happen 5 to 10 years. I think 2 to 3 is enough. So whatever you said, I think it will happen much faster than we thought. It's very, very accelerating. We can see it in the AI landscape. Like you have an invention tomorrow, and in 2 months it's absolute. And we never seen that in our lifetime. It's something new for all humanity. So I think if you need to think about the future, not only wearable device, all the AI revolution. So you mentioned the data, I agree 100%, but also what about robots? Maybe in 5, 10 years, if I'm not mistaken, Elon Musk said everyone will have a robot at home. Maybe we don't need to have wearable anymore. They will be our companions that are wearing everything for us and taking care of us.
Yeah.
So 5, 10 years, it's a big time in our lifetime. This is what we call the singularity somehow. When things are accelerating, we'll reach a point, maybe we'll have an invention every week. And maybe the big question, can we go with this as a human, We have spent, 30, 40 years with compact disc, and now we have the cloud, right? So what will happen with wearable? I think 2, 3 years is enough. I think in 5 years we'll have the robot taking care of us.
That's true, 100%. I agree with you. I believe at any changes happening in the period of the mankind, it's been some tough days, like internet comes in. Dan was like, credit cards, everything at the first acceptance of it, it's so hard for people are ignoring them. But when they see the benefit of it, everybody's going to be more willing to accept that changes. Like a few years ago when the ChatGPT came out, everybody was like, oh, what AI is helping us. AI, how can solve our problems? And bringing AI and machine learning models to our life, it's going to happen in super faster. I believe I do agree with you. Next 2, 3 years, it's going to happen to all of our lives. And even the hospitals, clinics, they can use these models to provide better services for the patient as well. It's already has been happening, integrated to the hospitals, using the models to predict better services for the patients they do have. And I believe when we had to need to change a point of view to these devices, and we bring it up to the insurances. If you spend few $100s now, you could save thousands of dollars in the near future. because the patient's gonna give us the information related to their health so we can better service them. It's gonna less cost you. I believe if you bring up this type of subject with insurances, they're gonna be willing to accept these differences. So they're all talking about the monies, that's the only concern they do have, but I believe just few $100 spending now, it's gonna save them so much money in the future.
So firstly, thank you so much for sharing these amazing insights. Again, I love probably we'll have robots and replacing these companions. So I know we have some time left, so I do want to open now to our audience for any questions. And I see one hand raised. Yeah, right there.
Right here's the mic.
So, AI is exciting and fast-moving and so on, but we have a lot of people, young and old, who are very reticent and fearful of it. And you're going to have them put a device on their body that they don't want to wear or they're afraid of. Like, how do you handle that? Because we're having a lot of pushback. And fear is a big non-motivator. So if you're wanting somebody who's afraid of it to wear it, they're just not going to do it.
I can tell you I've dealt with that. I've dealt and engaged with both physicians and patients who have said just that. You meet them where they are. You ask them, what is the fear? What are you dealing with? And give them what they're asking for. That's whatever clinical environment you're dealing with, whether it's in mental health, whether it's dealing with cardiac issues. But this is just a tool to help you and to engage you to make your situation, your chronicity better. We're just here, we're just an advocate advocating for you. And this is a tool to help you. Just like a stethoscope is gonna listen to your heart, this is another tool to assist you in monitoring you all day long and let us know and give us feedback. It's not going to enter anywhere else. It's not going to give us any more feedback than what we allow it to do, because it's a tool that is assisting us to make you better, and it's advocating for you with us.
I love that. Thank you for sharing.
Definitely, I believe we're providing real-life scenarios for the patient. They can see how it's going to be improve their life. And I believe so many of clients I have, they are just concerned about the AI, what the AI is. AI is not a robot, it's not a huge thing. AI, it's a model with so millions of rows of data can help you in a specific user cases you are using that. It's just a model, it's just a robot, and it's all handled with the humans. It's not gonna eat us or anything. It's just a simple thing. We're not gonna be so much concerned about the AI. We just wanna see it as a model. We provide the related data to it, and it gives us the feedback. That's it, it's all it has.
Thank you for helping with some of the fear. I know there was another question right there. Okay.
Great discussion. Thank you for the insights. Just wanted to ask a question about post-surgical care. We've been talking about accessible healthcare, preventive, and things like that, right? But it's inevitable that things happen. I'll give you a real-time incident. A couple of years back, I was consulting with the government of India. I was the chairman of the 5G Standards Committee. And this is where technology is evolving, right? And with the help of a physician in London, they were able to perform a very complicated surgery in a remote village in India, using 5G. That was one of the pilot projects. And it was a successful surgery. But what next? Now, when you think of the confusion of technologies, you see that happening, you see wearables coming into picture. Now, if you're able to give those people who otherwise can't afford a device so that the patient's health can be monitored subsequent to that. So what are your thoughts on that in terms of using these wearables in the context of post-surgical care?
So yeah, that would be a good idea, generally speaking. So like we said, with AI, they're just starting. So it's a good thing you guys have been able to do that in India. So that's an example. So I don't think people within that community have been able to see what that happened. You know what I mean? What happened in that situation? So that's even going to be, for lack of a better word, like a selling point for them, to see the importance of those things. And like I said, with anything, it's all going to be all about educating people. The problem is some people just don't, because I'm a provider and I think this watch should help you. I shouldn't come and try to sell it to you. I don't own the watch, so why am I doing all the marketing? But we do, whether we like it or not as providers. We need to explain, and the fears are genuine. I was one of those people that I didn't want my credit card on Amazon, period, as educated as I was. Because I don't know who's going to charge something. And then I don't have the time to call Amazon and be on the phone for 3 hours. So my fears were really genuine, right? So all it needed was someone to make me feel okay and make me understand that it's okay for me to do that. So once we accept that and we understand with people, and we go out of our way to explain to them and understand that their concerns are really genuine, most people will do it. You will still have people who don't use a cell phone up to date. They still exist. But you would be shocked that most people who are worried about AIs have cell phones. That's what I'm saying. So that's where the education comes in. You're worried about AI. You have a cell phone that's recording everything you're doing anyways. You might as well drop the cell phone. So that's where the education comes in, and it's going to be something for all of us. I'm going to educate your mom when she comes into the clinic. You also have to educate her when she goes home. So if we're all on it, everybody gets comfortable at some point. It's really going to be a game changer for everybody. That's the truth.
So any more questions in the audience? We have one more.
Thank you for the insightful conversation so far. So I have questions in 3 areas. Okay, the first one is, as you rightly said, AI has been evolving at breakneck speed, and as we are so excited about all the great stuff it is doing or it will do, there are some challenges and fears also which are there. So my first question goes into the area of AI bias. What challenges or what steps you think of or you're already taking to reduce the AI biasing as much as possible? I know it cannot be made to zero. I mean, it cannot be made to 100%, but at least what are the steps, what you can share that would be very insightful. And then I have 2 more questions after this.
Okay. The fact that you have AI bias comes from how we developed AI, right? And the solution is to develop your own AI. And here when I mean your own AI as an organization. Mm-hmm. For example, for historical reasons, most of the data we have is based on white people. That's what we have on the internet, that's what you have generically. But honestly, in all other countries, and if you talk India or China, they have their own data. And they can develop their own models with their own, let's call it rules, without the bias or relatively with a different bias, because always we will have bias. I have seen some people who are funny, think if we ask AI, we'll have an independent answer. It's not. And you mentioned something that was very nice. In fact, Google search is AI generation 2. And ChatGPT was generation 4, right? Mm-hmm. So it's all about the same kind of algorithm. It's about models. So the solution, we need to develop your own custom model. And I don't mean adding a file to ChatGPT and still using OpenAI. No, your own model running in your own servers.
Yeah, and I just want to add one thing to it. So at the grassroots level, and again, I know it's now a very sensitive word, DE&I, so I'll be very careful in what I say. But I think it's at the grassroots level, having the diversity in people who are writing these codes. I know now it's beyond that point. So now it's pretty much the prompts you ask. So again, you can certainly mitigate a lot of bias when you are asking and this is for Gen AI, that you can ask certain prompts and you can then prompt and confirm that, is this biased data, do you think? So again, I think that's one way, but I think at the grassroots level, it's definitely having more diverse people, which is like women, which is, not just because if you think about people who are coding in the back end, it's mostly males and it's like certain gender type or stereotype. So I think that's probably the place to solve for it, which again, I know there had been a lot of work done. Now, I don't know what the future of that would be. But yeah, just wanted to share that. But then on the Gen AI, on the front end user side, it can be the way you prompt or you ask the question. You can certainly at least get the best out of what it is in the back end.
Just to add one thought, organizations has to follow the ethical AI practices. Like they need to not focus on one particular data set. They should look at the diverse data, and then with the diverse age groups, and also organizations has to set the accuracy levels. How much is acceptable within the organization? Is it 80% accuracy from the model or 90%? So that's where it's about the organization, how they accept these AI standards and put the boundaries around and compliance requirements on how they wanted to use this data for the good.
As you can see, the concern we all have here is a major concern is all data, and the privacy behind it. That's a major problem we do have right now.
Exactly.
Now you're.
Although I can go more on that one, knowing that what happened with the United Health Group rejecting all the Medicare claims and things like that. But I get it. I think the second follow-up question on that one is which is one of the major challenges in the healthcare is interoperability. Now, you are trying to get data from, and if I talk just the medical wearable devices right now, again, I'm not talking EHR, EMRs, everything right now. Of course, they will all have their different APIs, different formats, different structures. How you are coping up with that? What are the challenges your data engineering team might be facing? How you are keeping up with that? Because that's not easy. And as you scale further, let's say today you have 1 million people using it, tomorrow you have 10 million people using it, which is a good problem to have, but that brings more challenges too, okay? Because then your data is increasing, and again increasing in structured, semi-structured, unstructured data coming in, okay? How you are, and what is the plan of attack for addressing those challenges?
I believe one of the concerns is we do not yet have the standardized data format. And so many of the providers and the smart wearables, they are the small private companies. They're not willing to share the data they have gathering from their users. These are the two issues we do have so far. I believe we need to get to the point we standardize all of these, and when we see these type of smart wearables as tools to help the patient and the providers, we need to ask them to provide the data, because so many, like for example, the big one, the Apple, they keep the data, they're not sharing the data they're gathering from the user because they just want to do providing and make the tools better for them and make more money for them. And these are the concerns I believe we need to be more willing to share the data from the user. So other companies, other tools, they can be provided for the patient as well.
I will add to this two organizations when you can get data, Epic and Amazon. Okay.
And sorry, he just had one last question, and that's, we'll let him finish. Okay, got it. Okay, thank you so much, everyone. Thank you.
Thank you.
Thank you.